Ebola or Ebola virus disease is a syndrome that belongs to a group of viruses that cause viral hemorrhagic fever. Viral hemorrhagic fever are usually syndromes where patients become, once they become infected, they can have a range of manifestations including fatigue, generalized body aches, fevers, at the sort of more mild end of the spectrum, ranging to severe bleeding and end-stage organ damage and sometimes death. Ebola is transmitted primarily through direct contact with broken skin or mucous membranes of an infected individual. This might look like touching an infected individual's wounds, kissing, cleaning up infected bodily secretions such as urine, vomit, or saliva. So at present it is not airborne. As I said, generally speaking, the general consensus is that it is spread through direct contact. It's probably unlikely to become airborne, mainly because it would require significant mutations within the virus to become so. So at this point I would say no. So it depends on the species. With the current outbreak ongoing right now in the DRC and surrounding countries, the fatality rate has been estimated to be between 30 to 50%, which is actually maybe a little bit lower than some other species that have been isolated in humans to date. And so there are a lot of factors that go into that, however, depending on your prior health history, for example, that may play into it, depending on the level of care that you're able to receive. So early supportive care, early aggressive supportive care in a healthcare facility is really crucial to be able to prevent that progression of disease as well. At present, we do have a couple of monoclonal antibodies that are available, that have been licensed for use, I should say. These are primarily licensed against a different species of Ebola than what is circulating right now. There's also a vaccine. It's been found to be highly effective in clinical trials, as well as in real-time or real-world settings, over 85% effective in preventing transmission. However, the caveat here is that that vaccine has also been studied in the context of a particular species of Ebola that's not the one that's currently circulating. And so there are ongoing discussions right now at the international sort of global health level to try to determine or ascertain how we could best study whether or not this vaccine may be effective. So the risk right now of transmission in the U.S. is very low. Right now, the outbreak is primarily occurring outside of the U.S., in particular regions of Africa. It's been over a decade since we last saw Ebola in the U.S. And since that time, we've taken many different precautions to be able to better prepare for such an event if it were to occur. UC Davis Medical Center is designated as a Level 2 Special Pathogen Treatment Center, which means that we're part of a network of hospitals that have been given the capabilities, the resources, specialized equipment, PPE, and training to be able to take care of patients with high-consequence infectious diseases for the duration of their stay. We're the only facility in Northern California to have this designation. And it really allows us the opportunity to be able to safely take care of patients in the community and in the surrounding communities as well. So the first thing I would say is be sure to keep up to date with the travel notifications that are being issued by your local public health authorities and the CDC as well in the U.S. To ensure that the zones that you may be traveling to are not at high risk at present time. If you do have traveled to affected areas, trying your best to avoid situations where you may be exposed to individuals that are infected, trying to avoid interactions with wildlife, very close interactions with wildlife, specifically, some of the hosts that we know may be associated with Ebola, for example, bats, and non-human primates, just to name a few.